Hey, good evening, everyone. Thanks for joining this session. This is the session on Is Aid Money Effective for Global Health? My name is Peggy Clark. I'm the Vice President of Policy Programs at the Aspen Institute and the Executive Director of Global Health and Development. We know we have some competition out there, so we're really pleased that we have this committed group of people that care about global health and development assistance. So if you want to come closer, feel free. We wish we had thought to offer wine and cheese and crackers for the cocktail hour, but I will offer you three fascinating individuals. All three of them are personal heroes of mine. They happen to run three of the largest humanitarian assistance organizations in the world and work in some of the hardest places in the world to work. So we will begin our session today with short bios. I want to tell you a little bit about each of them, and then we'll move into some questions. Neal Keny-Guyer is on my right. Neal is the CEO of Mercy Corps. I've actually known Neal since we were in our 20s when we met in the Afghan refugee camps in Pakistan when we worked for Save the Children. 10 years ago. Neal is the CEO of Mercy Corps. He joined Mercy Corps in 1994. Under his leadership, Mercy Corps has emerged as a leading international humanitarian and development organization with operations in nearly 40 countries, a staff of 3,700, and an annual operating budget of $308 million. Mercy Corps has distinguished itself by working in some of the hardest places to work in the world, including Pakistan, Afghanistan, Haiti, and other places, and is often one of the first agencies in those environments. Neal is from Tennessee, which you may not know since he's in far-flung corners of the world now, and he began his career working with inner-city kids in communities at school and at-risk youth in the inner cities of Washington, D.C. and Atlanta. He then worked with refugees in Thailand with Save the Children. Neal has an interesting set of relationships. He's on the Yale School of Management board. He's the one graduate member on the Yale board. He serves on the board of Imaginations, and he lives in Portland, Oregon. Welcome, Neal. Nancy Aossey is the head of International Medical Corps. International Medical Corps is a large non-governmental organization that's dedicated to saving lives and relieving suffering by delivering medical relief, healthcare training, and development programs to build self-reliance. Nancy became CEO shortly after its founding in 1980. Nancy has distinguished her life's work by providing testimony to a number of administrations on development assistance globally. It's one of the largest humanitarian organizations in the world. Nancy also manages 3,500 staff and volunteers. And again, she works in some of the world's most challenging places: Democratic Republic of Congo, Liberia, Ethiopia, Iraq, northern Uganda. Nancy has worked in Haiti in particular, and she has been honored by Los Angeles as a woman who makes a difference in the year 2000, and she was named by Glamour magazine as one of the country's most outstanding young working women, among many other attributes. And our last speaker today we're really pleased to have Sophie Delaunay. Sophie is the director of the U.S. Division of Doctors Without Borders, Médecins Sans Frontières. I'm sure many of you are very aware of their work in watching footage of the earthquake in Haiti and elsewhere. MSF is an interesting organization. Its principle is of providing independent and impartial medical care to people trapped by wars, epidemics, or natural disasters, regardless of race, ethnicity, religion, or political ideology. And that approach has guided their work in every country of the world where they work today. Sophie began a lot of her work in Thailand, also in refugee camps, which has influenced her thinking throughout. So welcome, Sophie. Good, so let's get started. I'd like to start by helping you to know, in the same way that I know some of these incredible individuals. And one might ask why you would choose to take a career working in a place like Northern Sudan or Haiti or Afghanistan. And so, Neal, I'd like to start with you. Can you tell us a little bit about what in your own life made you decide to commit your life's work to helping the disadvantaged and to working in some of the hardest places in the planet? Was there a moment when you decided that you could make a difference in those kinds of places?
Thanks, Peggy. The first thing I'd want to say is that since Peggy mentioned I was from Tennessee, is that, you know, the fact that I'm starting to speak first, my grandmother and mother would both roll over in their graves and be smacking me for going first. So I apologize. But then they would probably say, you know, whenever there's 3 roses, there always has to be 1 thorn. So I will start with that and just say that, you know, for me as a child, kind of on the tail end of the 60s, the tail end of Vietnam, grew up in the South during the Civil Rights Movement, that those forces influenced and shaped who I am. And I had a chance to learn from and grow from and be with inner city kids. And I, you know, felt a calling during the killing fields of Cambodia. And it really was the firsthand witness overseas, both of the needs and frankly of how much one grows as an individual through service, but also through being touched by these amazing ordinary heroes that, you know, we all encounter and experience in our work all over the world. And, you know, I feel my life's been very blessed and graced by that.
Good, thank you. Sophie, let me ask you, Doctors Without Borders, MSF, is an organization that I think it's become sort of a household word now. Many people know about it. And I think I can probably speak for everyone in this room to say, watching some of the footage, for example, of the recent Haiti earthquake was really, really difficult to watch and hard to imagine you being there and your staff being there. So I'd like to ask you, what about your own personal philosophy has kept you going in situations like that? What has given you strength, and what has allowed you to think that MSF can make a difference there?
Well, there are many questions in your question, but what has made me engage and stay in the organization is of course that it's so meaningful, and it's a kind of luxury to work in an organization where everybody is hugely committed, full of energy, and as you say, this is an organization which has built a very strong principled position that has allowed to gather great support from all over the world. So basically we have the means to operate and to constantly seek better quality of care. So this is very motivating for someone. Another reason for, as you said, it's very difficult. It's easy to be burned out in such circumstances when you face conflicts and suffering. And the policy of our organization is precisely to send staff for short assignments. So I've been to Thailand, then after I've been to Rwanda. Rwanda was a very traumatic experience for me, and I was offered a position in the headquarters for some months. But for me, that was a unique opportunity to, stay in the organization and at the same time take the necessary distance and digest from my previous experience. So throughout the years, I've gone back and forth to the field, to the headquarters, and every time I didn't want to finish my career in this organization by the headquarters, so I would go back to the field again one last time, and it's been like this for 17 years.
Good, thank you. Sophie, let me ask you, in your really distinguished career running International Medical Corps, what's one thing that you're most proud of? I'm sorry, I said Sophie, I meant to say Nancy. What's one thing that you're most proud of?
I guess I would say we've had the opportunity to really work with some really wonderful and extraordinary people in the various countries that we work. Our focus over the years has always been around training. And in fact, it's one of the reasons I got involved in 1986. It was the idea that, here you are raised, at least in my case, I was raised in Iowa, privileged. That is, I had, 2 parents who cared for me. I went to bed without hunger. And I had so many things that people don't have access to in the developing world. And the most satisfying thing is that when you have the chance to work with a person or a population, group of people at the local level, and restore some kind of hope through skills, through knowledge, through transfer, through skills transfer, where you can actually impart, some of the things that we know that they don't know just because they haven't had access to the knowledge or education, where they can help themselves. I really think that the whole concept of self-reliance that so many organizations like mine are involved in, helping people help themselves, is what makes the work so worthwhile. It's certainly what I'm most proud of because it's our major focus, which is training. And one byproduct of that I hadn't considered along the way until the last few years was that so many of the people that we are working with in like displaced camps, et cetera, the quote, the beneficiaries, become the healthcare providers themselves when they have an opportunity for healthcare training. And that restores to them a sense of dignity and hope that they haven't had before, and that is probably what makes me most proud.
Thank you, good. So I think most people know that we're living in a moment of unprecedented assistance in development overall, and humanitarian assistance, and particularly in global health. There's never been more money going into global health. The last decade has seen the Gates Foundation make major contributions, major funds, the Global Fund for AIDS, TB, and malaria, the Global Alliance for Vaccination has made a huge difference. And in some countries, we have seen some real successes. We've seen reductions in malaria, we've seen reductions in child mortality, but in many of the poorest countries, the needle is really not moving, in particular in Africa. Neal, let me ask you whether that's your observation, whether you think that's the case, and why you think that is, and if you think we should all still believe in development assistance, even though we are recognizing that we aren't making as much progress as we should be.
Well, first, yes, we should all still believe in development assistance, because without that, I think our hopes really would diminish. And I think the bigger picture story, is one of some fairly dramatic successes. If you take, the total developing world, and you just look at how infant mortality rates have come down, child mortality rates have come down, maternal morbidity rates have come down, the Gavi Alliance, 34 million people saved. There's some really impressive stories out there. Or I see Chris here, organizations like PATH who bring such innovation, and blend kind of market principles, have done amazing, amazing things. But if you I don't know how many people here have read The Bottom Billion, Paul Collier's book. But if you take the bottom billion, that seemingly are these folks that are trapped in about 55 countries, 70% of that population lives in Africa, it's a different story. So if you take the developing world as a whole, life expectancy has risen. For those countries not in the bottom billion, has risen to 67. Those people who live in the bottom billion, it's 50. If you look at child mortality, the rate of those in the bottom billion is 14%. Elsewhere in the developing world, it's 4%. If you take child malnutrition, it's 36% in those people in the bottom billion, and elsewhere it's 20%. And if you just look at overall growth rates, the people that live in the bottom billion have had negative growth rates. In fact, those countries are below where they were in 1970, despite all that, whereas the rest of the developing world has made dramatic progress. And so I do think as a community really committed to development, we are challenged how to bring real focus, real targeted, smart strategies to those countries in which the bottom billion live. And that is the principal challenge going forward for the development community.
And just to add to that, and of course, as Neal said, if you look at those countries in the bottom billion, most of them, or many of them, are conflict areas or extremely poor, what we call fragile states. And that is the central challenge, because and certainly in conflict areas where all of us work, when you're trying to impact on, say, maternal mortality in a place like the Congo, and you've got mobile populations, and you've got tremendous violence, then the question becomes, how do you create access to health care, and how do you reach out to people when their lives every day are racked by some kind of conflict or violence or some kind of atrocity that's being carried out? And I think that there's been reluctance for donors to take a risk in some of these countries. And these countries are the hardest hit. I mean, these are the places where we need to be, where we need to figure out strategies, where we need to problem solve. We need to look at and say, okay, populations move, you have spontaneous settlements. The situation today may have been different from the situation 6 months ago in a place like Afghanistan or Darfur. So what do we do about it? And how do we overcome the problems that come with trying to help people in conflict areas. And I would say there's a way to do it. There's absolutely a way to do it. But it's not a surprise that people living in places like that have had the least amount, I would say, of progress overall.
Sophie, let me ask you, MSF goes into really difficult situations and often tries to be the first in. What's your formula? What's your approach? How do you, when you land right after the tsunami, for example, or right after the earthquake in Haiti, what has made MSF successful, and what are the challenges it faces?
Well, first of all, after 40 years of history, we've evolved, and we could have made the choice of expanding our mandate, as we could say, and our scope of activity. Actually, we made the opposite choice. We considered that despite of the magnitude of the needs, but given the development of the aid community, it was important for us, not to try to do everything. So we decided to focus on what we did the best, that was really acute emergencies, response to crises, especially working in conflict areas. And this is where we developed the expertise, both in logistics, but also in our approach to medical care, try to constantly upgrade the standard of care, even in the worst conditions. And I think that actually what makes us more successful sometimes than others also, is a combination of factors, is of course this experience that we've gathered. It's the amazing energy that we have in the organization by having new fresh blood constantly, but also it's sometimes opportunities. We've been immediately reactive in the Haiti earthquake because we were there. We were in Port-au-Prince. We had hospitals. We had surgeons. We had been working there since 1991. We had 300 staff working there already. So of course it makes you more reactive, and we could save our medical stock, so we could also immediately treat the patients. It was more difficult in Pakistan in 2004 for the earthquake, because we did not know the area, we had to rely on other networks that we had not developed, etc. So it really depends from the context. But since we're working in 70 countries, and in some of them they've been at war for so many years, it's true that in the Congo, as Nancy said, or in Sudan, or in Somalia, we have a good knowledge of the environment, people know us, and it makes us even more reactive to the emergencies.
Good, thank you. I want to ask all three of you, what's your sense of breakthroughs that are on the horizon in terms of development assistance and humanitarian assistance in health? What are some of the things that you're most excited about, that you're embracing as organizations, that really could be game changers in terms of having significant impact in the work that you do?
Well, I'll jump in. I think one real positive development has been the shift away. It's taken some time, but the shift away from stovepipe or vertical funding and more into integrated programming. We're starting to see that a number of major donors have been listening, to our complaints over the years about these very disease-specific kinds of programs that create this tremendous dysfunction within the whole global health community, and that's been heard. And as a result of that, they're taking a more of an integrated approach, because this is how we all work. I mean, you can't work in these narrow little silos, of course, and in fact, it doesn't even play out that way at the village level. So I think that the holistic, integrated programming, the outlook that you really have to look at something as an integrated issue and approach it that way, and therefore you have to line the funding mechanisms up that way as well. Because when the funding streams are lined up in a dysfunctional way, we all behave in a dysfunctional way because we're all twisting ourselves into knots to make ourselves fit into the funding streams. So I think there's a recognition. I'm glad to see that. And I think that will, over time, be a big game changer, assuming that it happens more quickly.
Neal, can you weigh in on that question?
Yeah, I actually think I'm tempted to kind of pull this around and pull it out and go. I think this has, as much potential to be a game changer in terms of development, particularly in terms of healthcare, as almost anything that's come along in many, many years. I mean, when you look at, the potential to just, map data in terms of child survival, to really map, where pandemics might occur, to do, connect community health workers in remote villages with information elsewhere. It's powerful. Or when you think of the partnerships that are emerging between the telcos and NGOs, community groups, the private sector, in terms of financial services and elsewhere, this is one of the most powerful things that I've seen. And I think it's part of, at least in my lifetime, you sort of think of there have been three big waves of development. You might say the first wave was bilateral kind of aid. The second wave was kind of the era of the NGOs, civil society, sort of our era. And then I think there has been this kind of wave of started kind of social entrepreneurship, social innovation, and now social enterprise that's bringing in kind of a blending of for-profit, not-for-profit solutions that's pushing all of us traditional aid organizations to think differently, to do things differently. And I think it's representing the possibilities of breakthroughs now that are really, really exciting in so many ways.
I think most of us are aware of the fact that some of the recent crises in the world have generated huge amounts of private donor dollars assistance. People all over the world, huge amounts of money went to your organizations, many of your organizations, for the tsunami, for Haiti, and others. And I think in some ways it really transformed some of the development organizations that received those funds. But Sophie told me a story this morning of a little boy, 10-year-old boy, who sent $10 to Haiti. And there's a story written about him in The Onion, and he wanted to know where his $10 went. So he went to Haiti to see if he could find what happened with his $10. And Sophie says there's quite a funny story about what he found. But I'd like to ask you all to comment on two questions. One, do you think that the public cares more about what's happening in the world with development assistance? And is increased funding from individuals a part of that? And two, what can you say about what this little boy found? And tell us that story as it relates to sort of the question of effectiveness of aid.
It's difficult to say if people care more, but people are...
First tell the story about the little boy.
Well, I think you told the story already.
What did he find?
Well, he saw many land cruisers all around Port-au-Prince and hospitals everywhere and patients and food, and he just couldn't find out where his specific $10 went. But I think the answer to this question is really, as far as MSF is concerned, we've spent, 10 million is $10, 10 million times his $10 in this emergency. Is the public more aware or care more than before? I don't think so. I think people are more aware, that's for sure, and the role of the media has been instrumental and is instrumental in this kind of emergencies. So I think it plays a great role in attracting the generosity of the people. It was, however, what I have experienced, because I was in the United States when Haiti earthquake happened, and I've never seen such a mobilization. And the generosity of the U.S. population has been overwhelming, and it's been the same in the 18 other, countries where we have branch offices. So this is definitely something which is quite astonishing. Regarding I would not compare Haiti and the tsunami, because although the reaction of the public has been quite similar, these situations are completely different. And in the case of the tsunami, there weren't many immediate needs. The wave just came, and there weren't medical needs to deal with. There was a lot to do with reconstruction, and this is why we faced a very difficult situation when we received this huge amount of money, and we had to call back our donors and say, we're not going to be able to spend it because we're not going to do reconstruction, and there is not much we can do. So in Haiti, we had learned the lessons from the tsunami, and we've monitored day after day the level of income that was coming into the organization And we were in contact with our operations on the ground, trying to figure out what was their capacity of intervention and making sure that the balance was maintained. And I think it's been really a success, because we've received 110 million euro for Haiti all over the world, and our budget for 2010 is going to be 90 million euros. So we know we have 20 million left for next year, but we know we're going to need much more than that. But at least the money that was sent for the emergency will be in a capacity to use it for that purpose.
Nancy, do you want?
Yeah, I just want to comment a little bit about the effect of the media. And so I'm going to go back to 1991 during the height of the famine in Somalia, for those of you who remember that. And we had been working there for about a year. And Bosnia was also, later on happening, but it was starting to break through. And we had a hard time raising money for Somalia. And then the media came in, the cameras came in, and it's hard to believe it, this is when headline news was really getting big. And suddenly, Somalia explodes on, into every television around the world. And that was a big, I guess, game changer in emergencies, because suddenly far off, place no one really cared about. Rwanda was another example. I remember I was there during the genocide, and it wasn't until all the people moved to Zaire, the camps, and suddenly, the media was there, and suddenly money flows. The money flows that come in from emergencies are really significant. There's this window of time, and that is because the public cares. They are connected, like with the tsunami, everyone was watching, people were on holiday, but people were paying attention, and in real time they saw this happening, and they immediately started writing checks. In Darfur, I remember being interviewed about the movie Hotel Rwanda, and because I was, as I mentioned, I was there during the genocide in Rwanda. And so they're interviewing me 10 years later about what I thought of the movie. Meanwhile, we had Darfur going on, and Darfur had not yet kind of exploded onto the front pages of the newspapers. Over time, Darfur became more of an issue. The media started covering it. It was more of a chronic emergency, and suddenly funds started to flow to Darfur. So there is the silent emergency versus the one we see in real time every day has had a profound effect on the way money is raised around emergencies. The flip side of that is places that are really in need of resources so often get shortchanged because people are always funding the emergency.
Neal, do you want to weigh in on that, on the U.S. public engagement, and if you think people care, and how do you get them to care about this issue?
I think people care greatly, and I think not just the media, but sort of the whole new applications of the media with social networks and so forth, and the ability of organizations like, IMC and MSF and others and ourselves to be able to bring it real time. We've got our aid workers are out blogging. You can bring video, real-time video. It's not slick, it's grainy. You can actually train, the people you work with, nationals from those areas. And so there's a whole education component going on that's engaging people. You're seeing it, in high schools all across this country. You're seeing it in colleges across the country. And you're seeing people make a connection, between issues. And sort of, I think there's this great awareness that there's kind of a seamless web of compassion, that connects a homeless child in this country with a hungry child somewhere else. And I, starting to get that sense that, and to the degree that we can make a difference, it's by thinking along that seamless web, and because it makes everyone your neighbor.
That's great. I appreciate that, Neal. I have to ask this question. All three of you are running organizations where some of your staff are in quite dangerous situations, and we hear about this in the news. We're aware of this. I know you can't speak about specific cases, but I can only imagine what it's like to be the leader of an organization when you're dealing with a situation like that. And it seems as if it's getting more dangerous, particularly for American organizations. Can you comment to us a little bit about how you handle that situation, if it is different? What's your sense of what that means for the work that you do? Does it mean you have to leave countries like Pakistan? How do you handle that? Nancy, you want to start on that?
Okay, sure. I remember in Bosnia, MSF and Mercy Corps were there as well, that one of the things that I noticed when we were there is that suddenly, under Milosevic and the Serbian militia, relief workers, local humanitarian workers, as well as expatriates, became targets. Certainly journalists were targets as well. Whereas if you were, used to be wrong place, wrong time, you got injured in the 80s, or I guess I'd say, but I guess in the early 90s, that changed. And I saw a fundamental shift of where you became the target. And certainly since then, this has been increasing. It's a little bit like, in some ways, the elephant in the room. Security is a huge issue. And one of the reasons it's a huge issue is that in our case, we're working closely with local populations. We're training the individual health worker. That individual health worker goes out into the community and they want to do something good. They may not want to grow poppies or, to produce heroin or be gun runners or whatever. They want to do something to help their community. Well, they become targets. It's one thing when you send someone from the outside, they become a target. You can get them out. But people go back to their communities. They live in their communities. These are their countries. Their families are in these communities. And we've had a number of kidnappings and killings, etc., targeting of our local staff. We had a Somali health worker just a couple years ago who was a healthcare provider for this village. We'd worked with this health worker for years and just executed leaving the clinic one day. And meanwhile, the people in that village no longer had access to health care. We keep this quiet because we keep it out of the media because we're in these situations all the time, and we don't want to jeopardize the security or safety of our local staff, and we don't want to jeopardize our ability to get them out safely if they are in a kidnapping situation. So it's a real problem.
Neal, can you weigh in on this question?
Yeah, I'm sure for all of us, every morning, you wake up and say a little prayer. You hope you're not hearing of the death or the kidnapping of some staff. I can share, we're dealing with 4 staff who were kidnapped in Pakistan right now, which made the news, and one was executed, and we're still trying to get 3 other folks back who are held in Pakistan right now. So it's very, it's very, very real, and it's challenging, and every organization has to think through, really very, very carefully what's going to be their security policy. I mean, we all have professional security advisors now. When I started, none of us did, for example. We have to, every organization comes to its own conclusions, regarding do you provide armed security. We've decided not to up to now, but it's tough, when you're operating in Iraq and Afghanistan and Somalia, Pakistan, to stay consistent on that sort of no arms policy. It's an internal debate. I think it's been particularly complicated. It was interesting, I don't know how many people heard General Casey today, who's just a brilliant man, has brought a lot of great thinking. But, for me, when you have militaries in these environments who are also doing humanitarian assistance, and humanitarian assistance is part of a strategy of, winning hearts and minds, and you have major donor programs that are designed to complement that, and and some of us take some of that money. How do you establish and keep and preserve your own independence, in a population that doesn't always distinguish, between that? It's a really big challenge in our community right now that, we wrestle with. The good news is I think we can come together and have that conversation together as an aid community, and also with the U.S. government and with the U.S. military.
Mm-hmm. So I know that the U.S. government is taking a renewed approach to the question of development and diplomacy and working on them together. What do you think about that? Is that possible? Well, Sophie's shaking her head no.
Well, actually, I wanted to bring a point on security.
Please.
Because you're right, it's one of the major challenges that we face. To go back to the diagnosis, it's true that there are more cases of, attacks, kidnapping, and killings. But it doesn't mean that the places where we work are more insecure than they used to be. I think that we also need to look at the scale of our operations today, the deployment of aid in this country, in this very unstable country, and the visibility of the assets that we bring in areas where, resources are more than limited. So just to put in perspective the situation itself that to some extent we have created. We put, we're more visible, but it doesn't mean that the environment has changed dramatically. And as far as we are concerned, of course we have very drastic security measures. We have curfew, we have, for the movements, very strict policies. I couldn't agree more with Neal about the necessity, which is key for us, to distance ourselves as much as possible from the parties to the conflict, but at the same time engage with them and discuss with all belligerents, explain them who we are, what we're here for, and also offer them the medical assistance that their family might need at some point. And to us, it's still a better protection than armed guards or an escort. Let's say.
Thank you. I want to save time for questions, but I wonder if either of you want to weigh in on that question of development and diplomacy. And I think most of us were struck by, in the Iraq War in particular, the notion of the military doing humanitarian assistance. And I know that in the new Obama development policy, which I don't think has come out yet, there is intentionally a linkage between the State Department and diplomacy and development more explicitly. Do you have any thoughts on that? Neal, do you want to weigh in on that? Is that the way you experience it on the ground?
Well, I mean, my own personal view was that it got a bit out of whack during the Bush years, and that the diplomacy didn't get as much attention as development especially didn't get as much attention, but nor did diplomacy, and we led with defense, and maybe that was necessary. And I think, what we did was we gutted the civilian capacity of the U.S. government to carry out development. And so what I think is happening, I think it would have happened under any administration, because it's widely recognized that we need to rebuild back up the civilian capacity, both in the State Department and within AID. If we're going to get gains in these really, really tough environments. I will say, to give the military credit, it's in so many of these cases, and many of us can comment this, the conversations that you have with the military are often, more thoughtful, because they understand the situation better than, some of the civilians associated with the Defense Department, who are, charged with carrying out a certain kind of policy, because those guys on the ground, do understand the linkage to development. Now, Secretary Gates, I think, has spoken very, very well about the need to strengthen development and diplomacy to complement any defense.
I want to save some time for questions, so let me just ask one question. I mean, I think most of you know that Bill Gates was here yesterday. He may still be here today. And I wondered if you had his undivided attention, if you had, a few minutes with Bill Gates, and you were able to tell him two things that you wanted him to invest in terms of global health, what would you say to him? So, Sophie, there you are in a room with Bill. So, Bill, here's what I need to tell you need to be doing.
Well, first, I would like to acknowledge his efforts to support global health issue, because this is really a tremendous and significant effort. And I also know we are extremely concerned these days about vaccination issues. We vaccinate millions of kids every year, and we're realizing more and more that the vaccines that we use are just not efficient, and that in 3 years we're going to have to vaccinate again, because the efficiency will not last long. So I know that the Gates Foundation is increasingly interested in supporting research and development on vaccines, and we strongly welcome this initiative. Now, we have concerns, and if I have Mr. Gates in front of me, of course I will ask him to use his, influence to help us innovate and advocate for bringing down the price of high quality drugs and medical materials, etc. Because this is really a problem. And the title of this session is aid effective, and in our view, the best way to be cost effective is really to provide the best standard quality of care. Because if you provide suboptimal care, the side effects are going to be disastrous. So it might sound like a kind of, it might sound cost-effective in the short term, but in the long run, it's totally devastating. So this is what I would ask him. The intellectual property issues are real issues for the Bill Gates Foundation, for the pharmaceutical industry. I think he's in a position to influence in the good direction, more flexibility in patent laws, in trade policies. That would definitely bring down the cost of drugs.
Good, thank you. So Nancy, you're in a room. It's just you and Bill. So
Wow.
Bill, what would you tell him?
Well, I would
out of international
first absolutely thank him for putting global health on the map, which he has done. As far as the 2 investments I would recommend, of course, he has an incredible command of the facts and the statistics, but I would point out that WHO has said there's a global health worker shortage of almost 4.25 million health workers. So if you look at sub-Saharan Africa, where this is the biggest challenge, they're 11% of the world's population. They carry about 25% of the global burden of disease, and yet they have 3% of the world's health workers. And in fact, there's a shortage of about 1.5 million health workers overall. If you look at the DRC, the Democratic Republic of the Congo, there's 1 doctor to every 10,000 people. And in the Americas, there's 25 doctors to every 10,000 people. Afghanistan, 1%, in a country where you have some of the highest maternal mortality, Afghanistan, 1% of the women in Afghanistan have a trained birth attendant available when they are in childbirth, and yet so many women die in childbirth. So what does that mean? It comes down to the health worker at the end of the day, no matter how much is invested in technology and in vaccines and in diseases, comes down to the point of delivery. There's this terrible shortage of health workers, period. And this can be fixed, this can be solved. It can be done through training of mid-level health workers. If we, 80% of the disease and the burden and the kinds of primary healthcare issues that you see in the developing world can be handled by a mid-level health worker. It doesn't even require a doctor. Plus, there are doctors within these environments, of course, that just need refresher training. So much could be done around healthcare training, but there's no really funding mechanism to make that possible. So, and then the second piece would be around technology. He has done a lot in technology, of course, in the health sector. And I would just encourage technology to be used toward this training, to come up with more ways to train people, to make health workers available to people in their communities through some of the technology changes that there have been.
So you don't get your meeting with Bill Gates because he had to leave for another meeting too early. So I'd love to turn it to questions, and I think there's a mic right here. So if you want to just raise your hand, and yes, this gentleman right here first. And I think we'll take, let's take 2 questions at a time and see how we respond. Yes, sir. Could you tell us your name? And
Bill Resnick, and I'm curious about, there was an article in the New York Times detailing the shift from HIV/AIDS care towards other chronic diseases, seeing that as more cost effective. And I think maybe you were referring to that indirectly, but I'm just curious about some of your comments on that, because it seems fairly concerning to me.
meaning that money is shifting away from
Yeah, and basically people who were getting treatment may not continue to get treatment.
Right.
And
okay. And there was another question, right? Nigel. I'm sorry, not Nigel. Yes, please. Right here. Yes, sir. We're going to take 2 questions.
Oh, 2 questions. Okay, my question is when the connection between conflict, violent conflict, and your work. With the thought that when Rotary International set a goal 25 years ago to eradicate polio in conjunction with the WHO and UNICEF, there were national, still are national immunization days to do that. It's largely been successful, although not totally eradicated. Warriors put down their guns, took their children into the clinics on those weekends when those children were going to be immunized. So war stopped on those national immunization days. What would you recommend to do with the warriors. And because it's the same children I mean, why is there no talk about ending war or ending conflict or putting in mechanisms that get people to think a little more deeply about what they're doing?
Good, great. Neal, can you take that question? Those two?
The latter one?
Yeah.
The conflict one? Yeah, and then I'm sure my friends here have a lot to add to that as well. The conflict one, I think it is true. I remember being in Sudan when, throughout the country, Jim Grant, some people may remember Jim Grant when he was one of the greatest leaders of UNICEF or in our community, certainly in my lifetime, and it was called Quarters Without Conflict. And there were these days of immunization in which, all warring sides would put their guns down and so forth and go in. It was extremely difficult to sustain. In almost all these cases, they became kind of one-off events. You could get it for a day or two. But what it did do is begin to demonstrate to people that that was possible. And so I certainly think we need to, it's almost become unfashionable to talk about conflict and peace. We want to talk about alleviating poverty. And so putting peace on the agenda more for all of our organizations, I think is critical. And I think we all have, a role to play in being, bridge builders between different sides of the conflict, providing win-win opportunities so that if you're warring around, national ethnic issues or whatever the war is around, that we, through our programs, whether it's our health programs, our microfinance programs, whatever we're doing, that we provide ways that community members can see a common future together. And I don't think you can work, in my view, in these conflict areas and really want to address underlying root causes and issues without taking on conflict. So I hope and wish that peace would come back on the agenda. I think it was given somewhat of a bad name in the last several years, but it needs to come back very, very, very strongly. And I think there's many wonderful examples we could cite where civil society and NGOs and others are the bridge builder. What I would say is that in almost all the studies I've seen, particularly in the bottom billion, that the likelihood as in poor countries when economies decline, the chances of war double, of conflict. And so you cannot separate, the growth issue from the conflict issue.
I just want to add one thing to in a specific example. So in 1990, we started working in Angola, and Savimbi, Jonas Savimbi, who was alive at the time, was the big warlord, UNITA, fighting against the government of Angola. And we, at the time, International Medical Corps had no presence, so we had to reach out and work with local communities to get a sense of what the biggest needs were. It was around infant mortality was high, it was around child vaccination. So we did something that at the time people thought couldn't be done, which was to bring warring factions together, the government and people from the government side and people from UNITA's side, into a joint immunization program. We even called it Peace Through Health or something like that. And it worked just great for a couple years. But going to Neal's point, it wasn't sustainable. One of the reasons it wasn't sustainable was because there was an election. Savimbi lost. He didn't like losing. He controlled most of the resources and the diamonds in that country, so he took the country back to war. And everything we had done regarding these collaborative activities collapsed because they went right back into a very, very violent war. In Congo, we had something called the Days of Tranquility where we partnered with UNICEF. And everyone laid down their guns. Our health workers would go in. We'd immunize children during that time. They were polio and different kinds of things we were doing at the time. But we're coming back. Our vehicles with our relief workers are coming back from a site one day. They get stopped on the road by people. We still don't even know who these people are. They put their AK-47s into the vehicle and they shot it up. And they killed some of the counterpart health workers we worked with. So I think the problem is that even though that there's a lot of things that you can try to do, whether it be large scale or small scale anecdotally, there are a lot of resources at play in these countries, and there's a lot of criminal activity that goes around in these countries where people really don't have much of an incentive, those in charge of the resources, whether it be a conflict area or not, to see that dying children are helped, because they're more concerned about their own, territorial issues or their own controlling the resource issues, et cetera. So I think, as Neal said, I think it's critical, but I think it's hard to sustain it when you've got these other factors at play, and I think that's what we're up against.
Mm-hmm. So does someone want to speak to the question about loss of resources for HIV/AIDS?
Maybe I can react to that one. Actually, this discussion started with when the Global Health Initiative Plan was set up, and at that time, malnutrition and neglected disease and mother and child health care was introduced in the Global Health Initiative together with the traditional PEPFAR support for HIV. The thing is that the PEPFAR support was not increased, and of course this was compensated by an increasing support to other diseases. So our position on that is, of course, we welcome the attention given to malnutrition and neglected tropical disease and mother and child health care. We deliver 100,000 babies every year, so we know it's a real issue. Malnutrition has been, we've long advocated for more attention and better quality food aid to tackle malnutrition. And neglected disease, of course, tropical neglected disease is by definition very, very neglected, and we want more attention on that. But we don't want this to happen at the expense of HIV, because there are huge global health needs. We think that we need to address all of them. It would be like, okay, we don't intervene in Haiti because we have another earthquake, in Guatemala. Well, no, unfortunately, we have no choice, right? And within our own capacity, we need to intervene. So we believe that the governments should continue the fight for HIV and not at the and at the same time be more aware. So you will say resources are limited, and of course they are limited, but our capacity of innovation is not limited. And there are many interesting prospects for more sustainable funding streams, like the financial transaction tax, like what UNITED created a few years ago. So we have some possibilities to provide sustainable funding to these kind of programs for health. And I think that it's no time to quit. There are still 10 million people in need of treatment for HIV. If we don't give them treatment, it's going to cost much more to put them on second line to treat the side effects, and the human and social cost is going to be astronomical. So that's the position that we defend on the...
Yeah. Thank you, Sophie. Are there other questions? We're coming to the end of our time. Let's take a couple more. This gentleman over here, and then...
Hi, my question is dealing with the reality of resource constraint and also thinking about your choices and specialization. So you already mentioned that MSF has chosen to focus on acute crises. My curiosity is, when you're not in a donor-driven environment that's telling you where to allocate resources, either because a crisis has happened or because the Gates Foundation has said, we're going to prioritize this, would you consider focusing more heavily on not on conflict environments? So for example, in India, where you talk about maternal health, you talk about tuberculosis, malnutrition, the quantity of problems are massive, the government functions slightly better, and the sort of treatments that you folks are able to introduce would have a massive and potentially more sustainable impact on people's health. Appreciating that there's so much need and it's incredibly emotional and required in conflict areas, but I'm thinking about how you would approach resource trade-off.
Good, excellent question. Let's take the one other question, the woman right there, and then, okay, right. Do you have the mic in your hand? Sorry, I can't see.
Hi.
Okay, we'll go first with her, and then we'll take your question just next. Thank
Patricia Ellis, Women's Foreign Policy Group. I used to be a journalist for the McNeil Era NewsHour, so even before Somalia, I remember Ethiopia, and all of a sudden, we got tape from the BBC, and Ethiopia was a big issue, and Americans were responding and all of that. But during that time, and of course what it meant was a lot of other issues, I can second what you said, are not covered just because there was not video. And I think this is a real problem, and there have to be other means. And obviously today with blogs and other things like that, it might be a little different. But the other point I wanted to raise was that what we found was that people were jogging to get on the air because that meant funding. And I would like to have you address this issue of coordination, collaboration, and competition, both, you know, whether to get on television or how it works on the ground. Because, for example, in Haiti, there are just so many organizations there, and even if you have your own niche, I mean, there is bound to be, you know, people still, you know, trying to get attention for their organization and maybe tripping over each other. I don't know, but that's my question.
Great, excellent question. And the gentleman who has the mic in his hand, let's do your question as well, and then we'll have a response.
Yes, I work at the World Bank on conflict and fragility, and my question is, one of the challenges we face is to get staff to, you know, these hostile environments, even within a place like the World Bank where there are strong incentives. I suspect, you know, you do as well in your organizations. And I'm wondering, other ways, innovative ways of attracting the best and the brightest to go and work in fragile environments, especially where there are global health challenges. I was just reading this article in the New Yorker. In Somalia, the African UN mission has just one qualified doctor in the area around Mogadishu. Is there a way we can think of some sort of global public service type, you know, opportunity you can offer, you know, students in medical schools or residents, you know, saying that, look, this is also a way to earn credit for your medical training, and you know, sort of in some sense broaden the core of people who can actually go out and work in many of these countries on these important issues.
Great, excellent questions. Anybody want to jump on one?
I'll
Nancy?
jump in on the question around fundraising and emergencies. There's certainly been a remarkable change in the way money is raised, as I mentioned earlier, around emergencies because of them playing out on our televisions or blogs or whatever in real time. And that, I think in itself has created both an opportunity, but I'd say a downside, at least for me personally, that I've been somewhat disappointed by our general behavior in that environment. First of all, you know, we all collaborate on the ground. We're all friends. I mean, we all respect one another's work. And in fact, there's been a lot of effort around building that kind of collaboration and coordination. Sometimes it's country specific, or sometimes it depends on the personalities of the country directors in a particular area. But for the most part, you know, we've worked with MSF in a number of areas, with Mercy Corps in a number of areas, and it's always been a collegial operational relationship. And at the CEO level tends to be true. It breaks down, I think, in my opinion, at the fundraising level. And part of that is because we are under tremendous pressure in that golden hour of raising money. And I'm unhappy about that, not only because my group is not good at marketing, which is why many of you may not have heard of International Medical Corps, but because I think it just brings out behavior that is not the best in any of us. And we know that a lot of the money is going to be raised in those golden hours. So, you know, like maniacs, we're trying to get our logos out there and then get on the, the news feeds and get the 800 number out there. And, you know, at the same time, we're organizing our operational responses like we did also in Haiti. We're at the same time saying, well, we got to be here. We have to make sure we got coverage there. I was teasing Neal earlier. CNN was covering something about the little boy Monley pulled from the rubble. That was their National Medical Corps teams, and CNN put up Mercy Corps as the one to give to during that whole time. And and I thought to myself, you know, what difference does it make? It's the greater good. We went on to the telethon. We did not share in the proceeds, but we went on to the telethon just to help raise money around Haiti. But the flip side of that is if you don't have enough money, then you can't do what you feel like you want to do. My organization did not raise enough money in Haiti, and we are there for the long term, and we don't feel we can do enough. So I think to some extent, it's the reality of what we're dealing with. We have to get out there, and we have to raise money during that golden hour. But I don't like it. I don't like it because I don't think it brings out the best in us, and I think there's a lot of dysfunction in the way that money is raised, that the household names are the ones who are better in marketing are raising the lion's share of the money, and because we're not as advanced in marketing, we're not. So again, personal opinion.
Good, Neal.
Well, maybe I'll take the resource allocation one, because that's
And
a
I think
great question.
We probably are coming to the
and
end of our
quick,
golden
but
hour
I'll just,
in terms of the
and but I'll just answer it for us, is that, you know, I actually think that, and I put India into that rest of the developing world, even though that's where the numbers are and everyone talks about scale. I don't think that's where we add the greatest value. I think there's tremendous capacity in India. It's sort of it's the laboratory of social innovation in so many ways. There's wonderful Indian NGOs. There are others that, I actually do buy the Paul Collier thesis, and I think it is important for the stability of our planet that we really find a way to address the bottom billion. The indicators in India and China and Indonesia and so many other places are moving in the right direction. And they could move faster with investment. But I actually would encourage some of those that are investing in India, because it is a little easier, because it is more stable, and certainly the needs are there, to come on and take a little more risk, in the CARs of the world, and the Somalias of the world, and the DRCs of the world, because you can do social innovation there as well. And I think if we could bring in a lot of those players who have tended to focus in Bangladesh and in India, I think we'd be making more progress, frankly, in terms of the bottom billion.
Great. So I think, unfortunately, we're out of time. We've gone a little bit over, but I really just want us to give a round of applause. Sophie and Nancy and Neal, we appreciate the work you do, and we've appreciated you being here with us at Ideas. Thank you.